Hello and welcome to National Herald. I'm Rukmini Sen. And today we are going to discuss an interesting report that's going to be released in Press Club of Delhi today. Joining me is Gauhar Raza, a former professor ACSIR, Chief Scientist, National Institute of Science Communication and Information Resources, CSIR. Gauhar Saab, welcome.
Thank you very much, Rukmini.
I have been seeing your press release, and I realized that the COVID survey report, it says the COVID survey report, the second pulse of the pandemic, a sudden surge in the scientific temper during the COVID-19 crisis, which is very fascinating because please tell me about it. How did you come to the conclusion that there has been a surge in the scientific temper?
If data
And what is your and the survey? What is the population you're looking at?
if the data collected is truthful, and we have seen a lot of fictitious data these days, which has been in news and in part of the discourse. If the data is true, then data speaks for itself. It is very clear that in times of crisis anywhere in the world, it's not only in India, but in times of crisis, people's knowledge, information level, and attitudinal change happens in times of crisis. There is sudden spurt of scientific knowledge which takes place in the society. It also establishes hegemony of scientists over other forms of knowing the world. But that can be established through data only if you are ready to collect information during the crisis itself. It cannot be collected later on because it tapers off. For us, it was important to collect the information, see whether our hypothesis that there is always a sudden spurt of scientific knowledge and people use, and receptivity of the people also goes up, can be confirmed or not. Hypothesis can be rejected. A scientific investigation should be ready to always think about null hypothesis. And therefore, it was very important for us to collect information, and in order to fulfill the other objective, which was that does the information collected by people, I'm talking about scientific information, collected by the people in order to cope up with the situation which has been created by pandemic or crisis, does it taper off with time? Do people forget that information? And therefore, a series of surveys was required. We have done 2 rounds of surveys, and therefore this report is second pulse of the pandemic. It is very clear from the data which we have collected that I'll take very simple example of which you and me have experienced during this period. That corona word itself, which is given by the scientist to a virus, a particular virus, or a family of virus, was not known to general people, general citizens, anywhere in the world. Today, everybody knows that. Virus itself, and people did not distinguish between virus and bacteria. But today, they distinguish between the two. The virus is transmitted through aerosol. Aerosol itself is a technical word now. Now, this technical word was not known. RT-PCR is known to everybody. Sanitizer is known today to everybody. The peak pandemic is known to everybody. Flattening of curve. These are technical terms. Today, they are in public discourse. The corona, shape of the corona is spherical with the spikes, is known to people today. People have absorbed this information, which is not very old. In a very short period of time, scientific information was released by the scientific community, and it was absorbed by the public. Why does it happen? It happens because People have to cope up with the situation that they are in, and scientific information saves them. It enables them, equips a common citizen to deal with the situation. They have confidence not only on scientific community, but because it brings in results and perceptible results. Therefore, people have a lot of hope with the scientific community. And this is what Nehru
So
called
I just want to
scientific
ask
temper.
you.
This is
So I
what
just want to
Pandit
ask you, yeah, I was coming to that.
Yeah.
That because we are talking about surge in scientific temper, if you, as a scientist, could explain what is scientific temper, how do you define scientific temper?
I'm always amazed that scientists kept on defining scientific temper, but the best definition was given by a politician called Pandit Jawaharlal Nehru, who was our first prime minister as well. He defines it in 2-3 ways. One, he says that scientific temper is temper of a free man. Now, you are not free unless you have scientific temper. And if you don't have scientific temper, you cannot be free. So it's one of the most precise, beautiful way of defining scientific temper. But he goes on, and at another place he says that the scientific method applied beyond the 4 walls of laboratory to deal with situations of life itself is scientific temper. And the third definition is a bit longer definition, where he says it is the ability to give up your preconceived notions, your belief system in the face of new data and new information, which means that everything should be questioned. Your own belief system should be questioned, and the ability to question your own belief system and apply the mind to accept the new data is that ability is scientific temper. I think this is the best definition of scientific temper, and because scientific information keeps on changing, therefore scientific temper is much more stable and desired thing in a society.
So what you're saying that because whenever there is a debate between religion and science, it always is brought up that it's not that scientists know everything. So you're saying it's true. The scientists don't know everything. It's a process and it's work in progress constantly, right? That is what you're saying.
I'm saying that all other forms of knowing the world, broadly categorized as religion, they claim to know everything. It is religious leaders who claim to know everything. Any scientist worth his salt will never claim that I know everything. In fact, a scientist will not even claim that I know all the science. One can find out bits and pieces of science as and when required, but one scientist can never claim that I know all the science. So there is no question of claiming that I have cracked all the questions that humanity is asking. But the scientific temper is to find out the correct or the best answer by applying scientific methods and scientific filters. We don't know everything. Of course, we don't know. And therefore, we keep on researching. Every day there is new research. Otherwise, research will stop. Scientific community will do its job.
So now, going by one of the definitions that you gave us of Mr. Nehru, the first Prime Minister, that scientific temper is what we believe in even outside the laboratory. That temper, which is open and free.
Method outside.
So what did you, in your survey, how did you see change in scientific temper outside the lab? What were people saying which I understand, they understand virus better, bacteria better, corona better. But other than that, what was it that made you feel that, or deduce that there has been a surge in scientific temper?
I can quote the data from the report that we are releasing today, but I'll not go into the data because in a program people don't remember what is the data all about. So I'll go by experience, which you have as a citizen and I have as a citizen. People completely rejected the unscientific methods which were suggested to cope up with pandemic situation. There was a debate around Gaumutra. People completely rejected that methodology which was suggested. Cow dung was rejected as one of the medicines or things that can ward off the pandemic or the virus. There was claim by Baba Ramdev that he has found out some kind of medicine for it, which was supported by 2 ministers of the country. Yet people rejected it. And today we see on the roads, in the malls, in shops, and even in dhabas and the roadside fruit seller does not have today mirch or nibu to save himself from, which was suggested in fact. Mirch or nibu or havan performed before he starts selling it. But you'll see sanitizer bottles there. So they have confidence on scientific community. They acquired the knowledge, number one, the first point that I made. Secondly, they applied that knowledge in their lives. They are wearing masks. You will see people wearing masks. You won't see people roaming around with the cow dung applied on their body, but you will see people wearing masks, using sanitizer, washing their hands. Washing our hands was not a national project for a citizen with soap, and that too for 20 seconds. But a lot of people absorb this information that for 20 seconds, you should watch at least 20 seconds to 30 seconds, you should wash your hands with soap. That kills virus. This information does not come from any religious text. This information has not come from any Baba in the country. This information has come from well-researched papers, which were communicated, the conclusions of those research conducted in laboratories came out, communicated by the media, people absorbed it and applied it. Today, we know that most of our population knows that oxygen is required. And therefore, people were running around in panic to get oxygen for their. Now, this information doesn't come from any religious leader. It comes from scientists. That when you fall sick, and this virus causes pneumonia. Now, pneumonia, once you know that it causes pneumonia, you also know that if it is severe, then oxygen will be required in order to survive. And government was found completely sleeping on this count. They had not prepared the nation for what we know as survival of the common citizen. They had not prepared. I'll make one more point that people as compared to the government, they lost confidence and trust on government, but they had very high trust in scientific community. There is a disjuncture which we have found that about more than 90% people said that India needs more hospitals as compared to religious places. We have too many religious places. Our priorities are skewed. This is what people are demanding. And what is being given? You observe Kumbh Mela, you build new mandir, and Prime Minister during that period goes and inaugurates a mandir. So there is a complete disjuncture between what is the aspiration of people and what is being given to them.
Could you elaborate a little more on why you say that they have lost trust? Why people in general have lost trust in politicians? And did you see a difference in the first phase and second phase?
In both the phases of the both rounds of data collection and analysis, we have found that people do not trust the government, and progressively during the second wave of the pandemic, they almost completely lost the trust on government. A very large number of people did not trust the data that is being released, that was being released by the government as far as deaths are concerned, number of deaths, and also the number of infected people are concerned. So they did not trust it. When we asked the question that what is your estimate of the data or the number of deaths and number of infected people, about 23 to 24% people kept on saying from a factor of 2 to factor of 5 to factor of 10. So all put together, it was a very large number of people who did not believe in data. Their estimate of what is the correct figure did change from a factor of multiple of 2 to multiple of 15, which is one indicator. When we ask that whose contribution do you value most? Did scientific community contributed to vaccine, to invention of vaccine or not? A very large population said that we give all the credit to scientific community. Another similar percentage said that scientists plus government should be given the credit. A very small segment, about 6% of them said that corporate sector had something to do with it. So they don't have trust on corporate sector. They have very little trust in government, and most of the trust comes from scientific community, which has risen during this period to save the lives of the people. A very large percentage was happy with the doctors and nursing staff. That is what we have observed.
Did they also feel that the second wave could have been avoided by the government? Was there any such observation?
You're absolutely right. For the second wave being so intense, people, the respondents have directly accused government of negligence. And in answer to the question, when we asked that government did not pay heed to the warnings given by scientific community, most of the respondents have agreed to it.
And as a scientist who has been following the virus and the spread, what do you think? What is your personal observation, if I may ask?
My personal observation is that this virus is going to stay for a very long time with the humanity in general. In India, the situation will remain critical for a very long time. There were, in my opinion, there are two things that are going to happen in future, for which we are still not ready. We are trying to create herd immunity by vaccination. India is a hugely populous country, like China. Now, this argument of herd immunity can work in smaller groups statistically. But in large groups and in large countries like India, it doesn't work, in my opinion. Because if you say 70% of the population of India, it'll be about 90 crore people. Let's make it 100 crore. Rest 30 crore people constitute a very large section of population. It's too large. It is more than many countries. This is part one of the argument, but one can say that statistically the same thing will apply on any population. It doesn't, because our society is extremely segregated society. The connection between the various segments of society on the one hand, between city and village, secondly, and between states, one state to another state. A Keralite is not expected to interact very frequently with somebody sitting in Srinagar or Mizoram. So the connection between them, it's not a homogeneous society. It's extremely heterogeneous society. So those areas where the virus has not reached, and I'm talking about the first strand of the virus, which infected most of our population, it has not reached. It may reach with a lag period. And then the entire area which has never been affected during the first wave or second wave or third wave will get affected. A locality next to your house may get affected with a lag period, applying the same argument. Therefore, the strategies have to take account of this aspect of disaggregation of society. Based on that, you should have strategies to inoculate people, to create herd immunity. General 70% argument will not work. At least in India, it will not work. As I was saying, that the first strand itself can keep on affecting you. But in the course, scientifically, we know that the virus mutates. So there is another problem, that once it mutates, the vaccine or the old infection, which has created immunity in your body, again may not work, just because virus has mutated. The third thing is that at the rate at which we are vaccinating people, suppose we vaccinate 100% people in 2 years' time, then by the time when we finished first year, those who have been infected those who have been inoculated or given jab in January would be ready for another round of inoculation and booster doses. That is also going to create a major problem in India. The government has not fulfilled its duty to produce and acquire sufficient amount of vaccines in the country. That is going to create again a massive problem.
And this has been understood by the people you have surveyed also, that there has been a lack of intent.
Yeah,
it hasn't been understood properly.
At least the policies and the implementation of policies is very, very clear that they have not understood these finer points.
You mean the people you've surveyed, or the government hasn't understood?
Government policies have not, does not show, the policy instruments that are being used do not show whether, if they have understood these finer points. Because I was arguing right from the beginning that those areas where the virus has not reached should be on the priority list of inoculation and vaccination. Instead of that, we started from those areas where the virus had already hit.
So, as we have to close the show, I want to understand surge in scientific temper. Now what? How do you see the future? Will there be any huge difference in near future, in distant future? What kind of changes do you foresee?
As a scientist, I cannot say that this is going to be the future. My hypothesis is that India and most of the world has reached a new normal. There will be some kind of tapering off. We'll slide back as the pandemic goes into the background. It cannot be all the time in the foreground. So there will be a slide back. But this slide back will not take us back to what was the normal prior to pandemic. I think we have achieved a new normal, and we are going to achieve a new normal, which will make our generations, younger generations, much more scientific and much more scientifically tempered.
Okay, that's a silver lining. You give us something positive to ruminate on, finally. Thank you very much, sir. Thank you for joining us. You're watching National Herald.
Having
I'm
me.
Rupani Sen. Thank you, sir.
Yeah, okay.